Pregnancy is a beautiful and transformative journey. It can also be an emotional roller coaster. Right from when those two lines appear on your pregnancy strip, your body and your mind can be in for a wild ride. Hello there, moms-to-be. You're welcome back to my channel where I provide health tips to help you make better health decisions. For those of you who are joining me for the first time, my name is Dr. Chandus and I'm a consultant public health physician and reproductive health expert. Today we shall be talking about something which doesn't get talked about enough: the surprising impact of pregnancy on a woman's mental health. We'll discuss the range of emotions that a pregnant woman feels, right from the joy of feeling your baby kick within your womb to the tiny fears that creep in as a pregnancy goes by. Please remember that most of these are perfectly normal. Now let's dive into the science of it all. Pregnancy causes increased production of two hormones, progesterone and estrogen, which are responsible for helping your baby grow, but may also impact on your mood and your mental well-being. Estrogen is the hormone that acts around the area that affects mood. Thus, it's not surprising that it may make a woman irritable, anxious, and even develop some depression. Progesterone, on the other hand, is responsible for loosening up your joints and your hips and to prevent early contraction. So it's not surprising that it can make some women have fatigue, feel a bit sleepier and slower than they usually are. I'll try to remember how it was for me in my last pregnancy and how I found out that I was actually pregnant. At that time, I was working in an immunization clinic, and I noticed that even though I had a relatively busy day, I would be so tired, like my fatigue level was so much that I would come back and I would sleep. Thankfully, I was not the one driving myself at that time. I would notice that when I come back from work, I would sleep right from the car to the house, and if I managed to get some lunch or something, I would sleep from then till up to sometimes 8 p.m. in the night. That was the first clue I had that made me begin to think that it's like there's something going on here. And after this happened for like a week, I decided to do a test and I found out that I was pregnant with my last baby. So therefore, the first thing that a pregnancy can do is to cause fatigue and sleepiness. So the first effect we'll be talking about is fatigue and sleepiness. You find that no matter how much sleep you get in the night or during the day, you'll still be exhausted. And this can be very, very distressing, especially if you're someone that's on your feet a lot, used to doing a lot of things, not the type that lays their head to sleep in the afternoon. You'll find that in the afternoon you will sleep and sleep because you will be so exhausted. Even during the day. Another example is when I was also pregnant with my first baby. I remember that I would come to work and as early as 10 a.m., I'll be in the clinic and I'll be so sleepy. Nothing can beat maturity and age. One of those days when I was sleeping at 10 a.m., after waiting and there was no patient, I decided to just rest my head. And one of the nurses, an older nurse, came and said, "Doctor, so you are sleeping like this. I hope something's wrong." I said, "No, ma, it's tiredness." She said, I said, although then I already knew I was pregnant. He said, "Is it tiredness?" I said, "Yes, ma, it's nothing but tiredness." She said, "Don't worry. See, these things don't hide. In another few months, we'll know whether it's tiredness or there's something baking in the oven." And truly, when she saw me in another 3 months, I was showing at that time. I was not, hidden anymore.